Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. It's no secret that West Virginia leads the nation in heart disease, with 7.2% of the population affected by heart disease. The most common heart valve disease is aortic stenosis, which affects 2.5 million Americans. It's a condition that occurs when your aortic valve is too narrow. So today, we're talking about aortic stenosis and how more recent treatments are improving outcomes with Dr. Ramesh Daggubati, Chief of Interventional Cardiology at the WVU Heart and Vascular Institute. Welcome, Dr. Daggubati, to Live Healthy West Virginia.
Thank you very much, Mary, for having me. It's really great pleasure.
It's good to have you here. So let's start, I just went into it a little bit there. Let's go into the specifics on what exactly aortic stenosis is.
Yeah, so aortic stenosis is a disease that affects actually anyone above 65 years of age, and also sometimes very young people, but that is much less likely, or the incidence is very low. About roughly 3% to 10% of the people in the United States get affected by aortic stenosis. It is a disease where the calcium builds up on the valve and it doesn't allow the valve to open up easily. So aortic valve is the most crucial valve through which the entire body gets a blood supply from the heart muscle. So if you imagine that the heart muscle is an engine, and this is actually the valve that allows the blood to go out the engine. So without that, we would be dead, unfortunately. And so aortic stenosis obviously is a very important valve, and to take care of aortic stenosis is really important for us.
Okay. Is it very common?
Yes, I mean, as we grow older, obviously the calcium built-up is much higher. So in people who are 65 to 75 years of age, that may be about 2 to 3% of the entire population have aortic stenosis. But if you take somebody 80 years of age and above, then nearly 10% of the people will have aortic stenosis. So it gets become more common if you grow older.
As you grow older, yeah. So what are the key risk factors? Who's most at risk for getting aortic stenosis?
Right. One of the risk factors we talked about is age. The other one is high blood pressure, high cholesterol, and also sometimes people who have infection, and some people are born with it, like when we call it as a bicuspid, meaning instead of 3 leaflets, there are only 2 leaflets that open the valve. And so congenital also is one of the risk factors.
Okay. What exactly causes it then? Causes aortic stenosis?
Right. As we talked about the calcium built up on the valve leaflet. So, for example, if these two are valve leaflets, the calcium will start building up on the edges and then comes to the tips of the leaflets. So the calcium is the culprit here, and it doesn't allow the valve to open as we normally do, and it does in most of us. So it only restricts the leaflet motion, and that is what causes aortic stenosis.
Is it caused by what causes the calcification? Is it poor diet, or is it hereditary, or?
Most of the time it is actually hereditary or age-related calcium deposition. Calcium is nothing but actually cholesterol plaque over time.
Okay.
So just like inside the coronary artery, but this is on the valve. So cholesterol plaque gradually becomes calcium. It thickens the leaflets and becomes calcium deposits.
Okay. What are the symptoms of aortic stenosis?
So most important symptom is shortness of breath. When somebody can't walk up a flight of stairs without stopping, and or having dizziness or loss of consciousness, and so, or leg swelling, similar to heart failure symptoms. Because the valve is not working well, heart muscle can get tired and starts failing, or actually the pressure inside the heart chambers will back up and make you short of breath because fluid builds up in the lungs.
Can you have aortic stenosis and not know it? Does it sometimes not have symptoms?
Very good question, actually, because a lot of people are underdiagnosed and or undertreated because of lack of symptoms, or nobody listened to their chest. And so definitely, I think nowadays awareness has to be brought to all primary care physicians and also anybody who can get a stethoscope and to listen to the patient's chest and see if they have a heart murmur. If they have heart murmur, then we need to do an ultrasound to pick up whether they have aortic stenosis or not.
Okay, that's good to know.
Yeah.
What happens if aortic stenosis goes untreated?
Yeah, so if patients have symptoms of heart failure, as we talked about from aortic stenosis, nearly 50% of them die in 2 years if they're left untreated.
Oh, wow.
So that's very dramatic. And if you treat them, the number comes down to about, still people die, but 20% mortality in about 2 to 3 years.
Those are much better numbers.
Right, yeah, and we're talking about elderly people. In younger people, the risk of dying comes down to 1 to 2%.
Oh, wow.
Yeah.
Okay. So it sounds like early detection is important.
Absolutely. I think anyone who has any shortness of breath, any leg swelling, I think they need to go to their primary care physician or a cardiologist to just, make sure that they don't have any other problems such as heart murmur and aortic stenosis.
Okay. So how do you diagnose aortic stenosis?
The best modality of diagnosing aortic stenosis is with an ultrasound, an echocardiogram. So people can have heart murmur for so many other reasons. Even somebody with just anemia might have a heart murmur, but that doesn't actually give us a best clue. But obviously, we do recommend a heart ultrasound or echocardiogram. And the echocardiogram can actually visualize the aortic valve very well. Sometimes we do it on the top of the chest called transthoracic echocardiogram. And otherwise, sometimes we have to put a tube into the foot pipe, and that's called transesophageal echocardiogram. And with that, we can detect aortic stenosis. We can also use a CT scan to just look at how much calcium has been built up on the aortic valve.
Do they have to inject dye? Is that when you have a CT scan?
Yes, we also inject dye to look at to see what size of the valve we should replace it with.
Okay, all right, good to know. How can we prevent then? How can we prevent aortic stenosis?
Yes, I think one of the things you touched is poor diet, and so I think anything that increases cholesterol buildup, such as deep fried items, whatever we love, whatever tastes
all the
so
good
good.
stuff.
The
I
good
know.
stuff.
I have high cholesterol, but I'm on medication.
Right. Yeah. So there are some studies to prevent aortic stenosis where the cholesterol medication is probably a good thing. So that has been tested out, and we feel that it is something that even if you don't prevent it, you can at least delay the onset of aortic stenosis by taking cholesterol lowering medications. So I think diet, making sure your cholesterols are lower, and exercise regularly, and will definitely make you live longer.
Yeah. What about if you have high blood pressure?
Yes. Yeah.
We need to keep that under control, I think.
Absolutely. The blood pressure has to be well controlled, and knowing your numbers is important. We nowadays recommend a blood pressure of 120 on the top and less than 80 on the lower readings.
Okay. And does diabetes have anything to do with this? Because it seems to affect everything. So if you're a diabetic, should you keep that under control too?
It definitely accelerates the process of calcium built-up and also high blood pressure. So they all actually work very closely in manifestation of aortic stenosis in these people.
So you got to know your numbers and keep everything under control, right?
Absolutely.
Okay, good to know. All right, so let's get into some of the treatments.
Yeah.
What are the different ways you treat aortic stenosis?
So traditionally, aortic stenosis has been treated with open heart surgery and obviously, it might take a toll on patient body because we are talking about in elderly people. And as I mentioned earlier, when we started doing research back in 2007, that's when in the United States, we were looking at other modalities of treating these people with aortic stenosis, especially elderly, and who are not eligible for surgery. So yes, surgery by opening up the chest, taking the old valve out, putting a new valve and sewing it in is one of the options. It's called surgical aortic valve replacement, or SAVR, SAVR. And in 2007, research has been started across the world and especially in the United States, where we can go with a catheter from the groin or from the neck or anywhere else, which
wrist.
Not the wrist, because the artery is not large enough.
Oh, okay.
So the neck or the groin are bigger arteries, or underneath the collarbone.
Gotcha.
They are larger arteries that we can actually put in a tube, which is a large tube, and push the old valve to the side and put in a new valve. So this is called transcatheter aortic valve replacement, or TAVR.
Okay.
But welcome to West Virginia. We are in the best place in the world.
That's right.
Right, because actually another approach has been invented by our colleague, Dr. Vinay Badwar, at our WVU Medicine and Heart and Vascular Institute. In 2020, he was the first one in the world to do a complete robotic aortic valve replacement in January 2020. So how is that done? It is a much more minimally invasive, which a small incision on the side of the chest and couple of holes, and that actually they can, similar to opening up the chest, they can take the old valve out, put in a bioprosthetic or like a pig or cow valve, or put a mechanical valve, whichever we want. And so that can be done in a minimally invasive way and using a robot. So we call it a robotic aortic valve replacement, or a RAVR, RAVR.
And compare like the recovery and the time, of a, we call that a RAVR, right?
Right.
The robotic one, to, full open heart surgery. I mean, this is a big deal, right?
Big deal.
There's a big difference.
Big difference.
Tell me what the differences are.
This is I think that's why I feel this is the greatest innovation, and very proud to be part of this team here. Traditionally, open heart surgery might take about 5 to 6 days to be in the hospital, and maybe patient might completely get symptom free within 2 to 4 weeks, and especially the sternal wound might take some time to heal, chest discomfort and all of that. Whereas with the minimal, like a 2 to 3 inch scar on the side of the chest between the ribs and couple of holes, you stay in the hospital for 3 days, and your healing process is much simpler, much easier, because the wound is smaller.
So it's less painful right?
Too. Yeah, absolutely.
Wow. So this kind of opens up this procedure to a whole nother group of people that before would have had, if you're not strong enough or you're too old for open heart surgery, here's an
absolutely. This is a fantastic alternative to many of the patients. Even today, we were seeing patient together, and a 75-year-old gentleman, and I was pushing for robotic aortic valve replacement, because we know these valves also have longer lifetime, and so they last longer, and then the transcatheter valves, which have probably a lifetime of 7 to 10 years, versus the surgical valves have been tested quite well, have been in the market for a longer period of time. They last maybe 10 to 15 or 20 years. And somebody can get a mechanical valve at a younger age, or a cow or pig valve when they're older. So robotic aortic valve replacement has really revolutionized how we take care of these patients.
Big deal.
Yeah.
It's a big deal.
Yeah.
As far as how effective is the RAVR procedure?
Yeah, pretty effective. The patients actually found great improvement in their symptoms. They were able to go back to their leading their life without any problems within a short period of time. And we have patients, I mean, we started only in 2020, but patients are definitely having equal or a better lifestyle than a SAVR or surgical aortic valve replacement. And even though transcatheter is done in elderly people and or very high risk surgical patients, RAVR or robotic aortic valve replacement is a very good option for people who are lower risk, who have that congenital heart valves such as bicuspid aortic valve disease.
Okay. Now this might seem like a dumb question, but if you catch aortic stenosis early enough, can you get rid of that calcification with medication?
Yeah. So it's
Am I dreaming?
No. It's actually not a dumb question. This is where people are spending a lot of money in doing research. And how actually we can limit the amount of calcification of the aortic valve. So even the newer valves are being tested to make sure that future will be to limit calcification of those surgical or TAVR valves. But at the same time, in your own native valve, can we somehow prevent calcification? Either this is by a genetic therapy and gene therapy, or actually by maybe treating the valves with a balloon with breaking the calcium. So these are the ones that they're trying to test it out and see.
Okay. All right. So maybe someday, right?
Maybe someday. Yes.
Okay.
I'm sure it'll be in our lifetime, though.
Okay. Oh, that's good.
That's good. Yeah.
Because I'm getting up there. Now, last month, in June, you were part of the team at the WVU Heart and Vascular Institute that performed, I want to get this right, a first in the world robotic TAVR or RAVR explant.
Yes.
And aortic valve replacement. Tell me about this and why that was such a big deal.
So absolutely, I think TAVR is transcatheter aortic valve replacement. Many people think it is so easy, so let me just go and get it.
Yeah.
Okay, because if you go from the groin, they have to stay in the hospital for a day. They can go out home and carry on their normal life.
Yeah.
But as I mentioned earlier, these TAVR valves last for, this is new technology, and technology evolves, we know that. But right now, the TAVR valves are lasting about roughly 7 years, 10 years. So by doing these procedures, which I'm one of them who would love to do transcatheter aortic valve replacement, but at the same time, by doing these procedures in younger people, and the valve may get degenerated, meaning the valves also, even though it is an artificial valve that we put in, that valve starts actually getting calcified, getting degenerated in 7 to 10 years. So in younger people, I think it is better to have a longer lifespan of a valve, which we don't have it yet, especially the TAVR valves. So such a person came to us, and I was fortunate to have Dr. Badwar in our institution, where I said that this patient probably we need to take the valve out. Or we can put another valve inside that valve by going from the groin, but that's probably is going to cause more problems. So we recommended a robotic aortic valve replacement, so RAVR, but first we have to take out the old valve.
Okay.
So the TAVR valve, which we placed from the groin, had to be taken out and then put in a new valve, which is again a cow or a pig valve, and with the RAVR approach.
Procedure.
So essentially, patient had a small incision with a couple of holes, and then Dr. Badwar, Dr. Wei, and his team went in and very carefully took the old valve out, the TAVR valve out, and put in a new valve and sutured back. And patient made a fantastic recovery and was discharged home. Yeah.
That's great. I mean, this is just another day at the office for the Heart and Vascular Institute here. I mean, it's just one world first after another.
Right.
And I want you to talk about that. I mean, people we've got like the best heart care right in our front, not our backyard, it's in our front yard.
Yes.
Talk about the depth of experience and of the whole team over at the WVU Heart and Vascular Institute.
No, absolutely. This is, I think, the mecca of aortic valve replacement innovation, in my opinion. And we are in a small state. People think, many people think West Virginia and mountaineers. What are we famous for? And there are lots of things, right? And one of them, actually, in the recent past, is this revolution that has happened with aortic valve replacement. And the first in the world for a single robotic aortic valve replacement. We have done 2 valve replacements. Even though I'm not a surgeon by my practice, but I take pride in taking care, giving the patients the best of best possibilities.
Yeah.
And I'm lucky to be in this place where we have the option for the patients to be placed at first and say that, hey, this patient would benefit from surgery, and can we do it minimally invasive with the robotic surgery, whether they need first valve or a 2-valve replacement or a TAVR explant as we have done, or even atrial fibrillation treatment as well. So we have the largest series of very successful treatment for atrial fibrillation with robotic approach as well.
Yeah, it's still not so much anymore, but it's not. It started as a best kept secret, but I think the secret's getting out now, which is good.
We want it to be out.
Yeah,
we want more patients to move into West Virginia.
Yeah, definitely. So before we go, I always like to ask, what's the most important thing you want our viewers or listeners to know about aortic stenosis?
I think the most important part is the new options that are available. Number one, recognize the symptoms of aortic stenosis: shortness of breath, swelling in the legs, dizziness, or losing consciousness. But then don't be scared to come and meet us and learn about all the options. Not every patient does have to have an open heart, an incision from the chin to the bottom of the chest, but we can do it minimally invasive. We can do it transcatheter. There are several options that are available. Please come and see us.
Excellent. Well, thank you so much for sharing all this information with us.
Thank you very much, Mary.
And again, it's right here.
Here.
It's right here.
In the front yard of WVU Medicine.
That's for sure. That's for sure. But thank you.
Thank you.
Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about the WVU Heart and Vascular Institute, visit wvumedicine.org/heart. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Daggubati and everyone at WVU Medicine, thanks for joining us.